The air you breathe is 5 times more important to your health than all treatment rendered by hospitals, doctors, and medication. The air you breathe is 2 times more important to your health than your genetic code. That's extremely important because if you fix your air, it's twice as effective as fixing your genetic code with no side effects. Nearly 60% of all preventable deaths are due to the condition of the air at home and work. You breathe approximately 3,000 gallons of air every day. So no treatment can overcome that volume. The air must be clean in order for you to get well.
Dr. Dennis has more than 38 years of experience in medical and surgical care for disorders of the ears, nose, and throat in children and adults. His expertise includes endoscopic sinus surgery, balloon sinuplasty, snoring procedures, CO2 laser vocal cord surgery, nasal plastic surgery, and ear surgery for hearing reconstruction, chronic infection, and cholesteatoma. Dr. Dennis practiced privately for 38 years in Buckhead, Atlanta, Georgia. He has treated over 80,000 patients over his career. He began his career as an attending physician and clinical instructor at Johns Hopkins. He has a reputation for listening carefully to his patients so that he can tailor treatment options to meet their unique needs. He also takes the time to determine if the patient is suffering from symptoms of mold, mycotoxins, or other environmental illness. He adds, quote, "I chose a career in medicine because I enjoy helping people, and ENT combines the best of medical and surgical practice," unquote. He pays special attention to the patient's environment to determine if air quality and the air that the patients breathe could be the cause of their disease. ENT is a specialty that can help most people get better. He treats all aspects of the ear, nose, and throat area with a particular focus on fungal sinusitis and other toxins. He is a pioneer for several breakthrough procedures, which we'll hear about today, removal of fungal balls and the remediation of fungi from the sinuses utilizing novel medical and pharmaceutical techniques. So it gives me great pleasure to introduce to you Dr. Donald Dennis to share with you his recent learning and his lifelong career in understanding these issues.
Neil, thank you for asking me to do this. I look forward to spreading my knowledge to others because this is what I love to do. So this first slide is a picture of a beach. So if you're standing on this beach, your air is perfect. And the idea is to get this air quality indoors. And so we're working on how to do that. So this is.
The air you breathe is 5 times more important to your health than all treatment rendered by hospitals, doctors, and medication. The air you breathe is 2 times more important to your health than your genetic code. That's extremely powerful because if you fix your air, it's twice as effective as fixing your genetic code with no side effects. Nearly 60% of all preventable deaths are due to the condition of the air at home and at work. You breathe 1,080 gallons of air per day, so no treatment can overcome that much volume. The air must be clean in order for you to get well.
So the CDC finally in 2019 declared a mold awareness week. And they are about 20 years behind on that. So what we do, when a patient comes in, just like you take a blood pressure and a temp on them, we do a tab test with a SDA auger plate on their clothing to see what their environment's like. It saves a lot of discussion when that comes back because a lot of people think that their air is fine because they did something for it, but yet they're still in a moldy situation. So we're trying to find out why and where the problem is. And then we have a questionnaire, and you don't want my nose, but I can tell which genus it is on their clothes. So, and you can, when you smell things on their clothing, that's important, because a lot of times they'll think their environment's okay, and then you know better when you can smell mold on their clothing. And then, of course, we do the urine mycotoxin testing, the serum IgG, and we can do frequency testing too. And our website, sinus5.com, is Sinusitis Wellness. This is what you just saw. So the air you breathe is 5 times more important to your health than all treatment rendered by hospitals, doctors, and medications. And it's 2 times more important than your genetic code. And 60% of all preventable deaths are due to the conditions of the air at home and at work. I think everybody knows this. These are organisms, and these are the mycotoxins they secrete. So I won't spend a lot of time on that. But this, I think, is really important. Dennis Hooper had this slide. He's a pathologist that does real-time labs mycotoxin testing. And he went to the lab at the hospital and got all the malignant tumors out there and did mycotoxin assays on them. And it turns out that out of all the ones, 87% of them have mycotoxins in them that are known to cause cancer. So it's certainly an important cause of malignancy in our country and in the world. So this is the sort of one of the main focuses of getting your air clean. So the environmental air filter, we use HEPA air filtration and central dehumidification that keep between 40 and 50% on the coils. So the central dehumidifier has got to empty onto the coil, but the instructions on the equipment say to empty down line past the coil, which won't really help. So the coil's got to be dry, and that's why you put central dehumidification, especially in the South. And then this new thing that I've discovered is the bipolar ionization. And the company that makes these things is called GPS. But this has 0 ozone and 0 hydroxyl. It's just positive and negative ions. They have split the water in the air into oxygen and hydrogen ions. And so there's an ionizer that looks like a fan that will fill up a room 20 by 40 by 8 feet in 2 minutes with ions, so that you know all the air they're breathing is full of ions. So that's going to remove mold, mycotoxins, VOCs, viruses, and bacteria, not in the contents, just in the air. So this is a big breakthrough deal for people to let them have time to get their house in order and be able to stay reasonably well while they're doing that. And then you can put this in the central system as well, so that all the air they're breathing is okay. And then we use the Aprilaire 5000 filter for the central system. And the one of the best HEPA filters I found is a Medify 40. It does about 800 square feet and is very inexpensive. And you can't have any fiberglass in your airstream or in the coil box. Typically, your coil box will have exposed fiberglass in there, and that gets full of fungus in about a year or two. So that has to be insulated from the outside, and all the fiberglass has to be removed. So we're talking about MVOCs in the sinuses, brains, lungs, and the entire system. The mucosa in the brain has the highest concentration. As it turns out, I believe the brain is going to have more mycotoxins than even the sinus mucosa. Well, I'll show you that a little bit later. For long-term wellness, you got to have clean air, clean water, and a proper diet. We focus on clean, mold and mycotoxin-free air in the environment where the patient knows they're getting better. They can feel they're getting better. So this is 5 times more important than any other thing we can do for them. We don't have their air right, all the other stuff we're doing is not going to work. So you got to focus on that. We use the yeast diet on everybody, and no chlorine in the water, especially when they go to restaurants. They got to get bottled water or take their own water with them. This is the route that the toxins get from the nose into the brain. This is one route, but they go also through the nasal mucosa and in the sphenoid sinus mucosa. So this is direct route to the central nervous system. So control mold and you control chronic sinusitis. The air quality is key, and we have markers now, and we're getting smaller units so that patients can tell if the environment they're in is good in just a few seconds. We're working on that. So basically, your particle count needs to be 50,000 or less at 0.3 microns per tenth of a cubic foot. And the units that is out there and the home inspectors think that 200,000 is okay. And that's okay for probably 80% of the population, but the people we see, it's got to be 50. And so we're trying to recreate what the definition of clean air is based on people who are sensitive. And then that should be okay for everyone. And the mold count on the plates has got to be 0 to 4 with a 1 hour gravity plate, or 0 to 2 in severely ill patients. So this is the thing I was talking about. It's called an ultimatum 1100. And this is the best thing I've found in all the years I've been doing this. These are the contacts and the phone number. It's a little fan. It's under 5 pounds. You can throw it in a small suitcase and take it with you. And this fills up a room 20 by 40 by 8 feet in 2 minutes. It replaces the ions every 2 minutes. So it's really the best thing I've found. And this is the HEPA air filter. So you have 2 ways to filter air. You have offensive and defensive. HEPA air filtration is defensive because the air has to come to it in order to get clean. And this is both offensive and defensive. You've got a HEPA 13 MERV on the back of it, and it's producing air to fill up a room. So you can take a mold plate and put it down the hall away from this thing, and it won't ever grow mold on it. Or you can take a mold plate that's got mold on it, and the mold on the plate will begin to decrease over the days because it broadcasts it throughout the whole room. So what we're really about is clean air doctors, because if none of our treatment works unless we get this right. This is about antigen removal. So antigen removal is the mycotoxin, the mold, and the VOCs. So this is a patient who had a heart transplant at age 3 weeks. And she's now 23 years old. So she presents with a sinuses full of polyps and mycotoxin. So this little white thing is a fungus ball. And all this should be black for people who don't know what this means. These are eyeballs. This is the brain up here. This is a fungus ball. So when we take the fungus ball out and then we put the mucosa from the sinus, the ethmoid sinus on the mold plate, it begins to get a brown halo around it. And that brown halo is mycotoxins coming out of the mucosal tissue of the ethmoid sinus. So this is how she presented to us. This is after 4 dermatologists did everything known to man. This is the best they could get her skin. This other picture over here is 6 days after surgery. So nobody in dermatology believes this is possible. They all think I'm lying. So because in their world, they're treating the symptoms. They're not ever removing the cause of the rash, of the dermatitis. So this is her face, and this is her face afterward, and this is her hand. So that's dramatic. But that's just to show you the power of removing the antigen, which is the cause of the systemic inflammation. So this is 2 rooms. One looks fine, one doesn't. But both these rooms have the same mold count. So you can't tell by looking. You gotta measure the counts. So just because everything looks clean doesn't mean it is. That's why mold plates are important. Now this is a physiology of why these people get sick with chronic sinusitis. So 20% of the population have this gene. So this is the antigen processing cell over here. It's a defect in the T cell receptor site. And so the antigen docks away from the proper site. And so anything can dock on that site after that site gets deformed. So so it becomes a super antigen. So it activates 30% of the total T cells versus 0.01% of the T cells, which is normal. So that's 3,000 times more T cell activation times 3 inflammatory mediators. So interleukin 5, 13, and interferon gamma come out. So you got 3 times 3,000. So it's 9,000 times systemic inflammation. So this causes toxicity in every system. And the T cell receptor motifs are similar to staph neurotoxin B and fungal mycotoxin. So that's why these people get chronic sinusitis. So this pink line here represents the mucosa, and this is an eosinophil, and these blue things are going to be moles. So the mole comes in, the eosinophil docks with it. The eosinophil ruptures and releases major basic protein, which puts pits in the lining and destroys the cilia. So now you got a pit in the sinus mucosa, and sometimes the lung mucosa too, depending on their genetics. And it gets full of mucus, and so bacteria start growing. So everyone chases the bacterial infection with antibiotics and steroids and doesn't get involved environmentally with removing the mold, which is the cause of the problem. So this pitting is important because you have these biofilms everyone's talking about. The biofilms come because of these pits. The pits are the lab upon which the biofilm forms. So if you just treat the biofilm and don't treat the air and the fungus, the biofilm never goes away no matter what you do. So this is the way to get rid of the biofilm, is just treat the fungus. And these are pictures of, this is the dendritic cell, the antigen processing cell with T cells bound to it. And so when that happens, the B cell, IL-3 produces more B cells, which produce more IgG antibodies. And then IL-5 produces more eosinophils. And all this just circulates around and around as long as the fungus is there, and it never stops. So now amphotericin in the nose is helpful, but you got to get the air because you're actually breathing 3,000 gallons of air a day. And you can't produce anything medically that'll defeat 3,000 gallons of bad air a day. So you got to get that done first. Now, this is what this causes this in reality. All these red spots are thousands of eosinophils trying to attack fiberglass, which this person is breathing, and the mole is attached to the fiberglass. It loves fiberglass. So now this mucosa is non-functional because the cilia are gone. So this, and I'd say most of these people have a fiberglass issue. It's pretty dramatic, and some of them get it in their lungs as well. So this is fiberglass with a light shine on it. Without the light, you don't see it, but there's more particles than you can see with this light, and they're coming out of the supply side, and everyone's breathing these. Now, 80% of the population doesn't get sick. They're getting damaged, but they don't have symptoms from all this. So this is a candida of the nasal mucosa. And this is after we use amphotericin and citrus drops and GSE. So we're treating the cause of it, which is the fungus, and that's how you clear it out. So this is a biofilm that we just cleaned out by treating the fungus in the air and in the nose. So this is candida in the sinuses, this white stuff. and this is their environmental mold count. So after with maximum medical therapy, you still don't clear this out unless you get the air cleared up. So this is after you get the air cleaned up, and this, the white is a light reflex, but all that fungus, the candida is gone that was in the left side over here. So this is a large aspergillus fungus ball. You can see this white stuff in here. Fungus secretes calcium salts, and the calcium salts show up as white objects on the CT scan. So this is the fungus inside the sphenoid sinus endoscopically, and this is what that patient was living in. And this is in her nose. She had aspergillus and penicillium tumors to count, and this is the air that she was breathing. So this is another one. She was allergic to all the azoles, and she had a severe lung issue and was near death when I saw her. So she had this big aspergillus fungus ball in her sinuses that was feeding her lungs. And so she had to get her air fixed in the house, but we cleaned this out. This is what it looks like. So you can imagine how much, this is the fungus ball, how much mycotoxins and VOCs she's putting in her brain up here from this in her ethmoid sinus. So once you get all this cleared out, then the brain begins to heal. You see this little white spot, I'll show you this later. So that means that she's actually got it in her pituitary gland. So this is a person who got damage on an airplane flight because it was full of fungus. And this is what she said, right?
This is patient Linda Stanley, who has noticed vertigo and cognitive dysfunction. Can you tell me what happened to you?
I was on an airplane on Thursday, flying 2 times that day, and later that night, early the next morning, started feeling dizzy, vertigo, fuzzy head, impact on my sinuses.
And then what happened to clear it up?
Well, today when you did this procedure,
With amphotericin into the sinus.
it immediately cleared my head. No more vertigo, no more fuzzy thinking. My sinuses opened immediately.
So that's removing the antigen. And this is what that looks like in the sinus. She's had surgery, so it's easy to squirt this in the maxillary sinus. This is the amphotericin solution. So we're removing the antigen that's causing it. So we do it on both sides and they get pretty quick response. Now, these patients have, if you do QEEGs on these patients, they have high voltage. High voltage shows up as red, and low voltage is organized thought processes and good cognition. But when you see all this red, they have poor memory, poor cognitive functioning. So when you treat the sinuses and in the brain with nebulization, you'll get it clearing up, but it doesn't work unless you get the air right. So this is what happens after you do that procedure. This is what it looks like on a QEEG. Now, some of these patients still have damage and they need to do neurotherapy to get rid of it, or they continue to have all their symptoms like anxiety, depression, and OCD really bad. We have some patients that keep throwing all their stuff away and keep moving to hotel rooms because they are getting the same symptoms that they had, but the symptoms are caused by the brain damage from the mycotoxins. So now this is called acute P300. This is an audiometric test to test when the brain is hearing the sound that hits the eardrum. So normal is 300 milliseconds. So you see the one on the top here, when the green and the red line cross, that means the brain has heard the signal. So this patient, brain never hears the signal. So we learned early on, if these patients aren't writing down what you're telling them, nothing's happening. So this is no response, and this is 461 milliseconds before that line's crossed. So when you're on word 3, they're on word 1. So these patients do not do well with auditory learning. So you'll have to write it down for them. That I have them write it themselves and they own it. So this is a piece of mucosa from the ethmoid sinus. So this is this piece right here. It's that little white spot in there. So when you see that, it's likely fungus. And so it is in this case. So when we take the tissue and assay it, we found it's trichothecene at 0.28 parts per billion in this tissue here. So, and also when we test the brown halo, we know that that's mycotoxin. So now when you see the brown halo, we know what it means. And this is another one. This is the piece right here. This is the piece on the plate before it grows out, before it grows out and distributes the halo. It takes about 4 days for the halo to form. So this is a controlled piece of ethmoid tissue that does not have mycotoxins in it, so there's no brown halo around it. And this shows the 0.28 trichothecene. So this is what we do surgically. We open all the sinuses, and this is called the cyclone. And the cyclone is irrigating with amphotericin or voriconazole while it's sucking. So none of the toxins are going anywhere. This is an incredible little tool that we have. And this is what makes it work. And you can see how fast the suction goes with this. It's very powerful. So you're sucking all the stuff away. So it's got 6 ports. So it's 360. And this is the surgery.
It's 10 seconds.
So that goes in all of 8 sinuses. So this is a before and after photograph. This is before surgery. This is like 3 weeks later. This is how dramatic, removing all the toxins from the nose, and so it stops showering the brain. So they get cognition improvement pretty quickly. And this patient had hearing loss for 10 years in the left ear. And I didn't think we could do anything about that. But this is the tissue got out of his ethmoid sinus right here. And this is essentially would be called kind of a normal CT of the sinuses, but it's not. We're looking for signs of inflammation, and this is inflammation. And that little white spot shows you got fungus in there. So all this brown stuff is aflatoxin, ochratoxin, zearalenone, and roridin in the sinus.
So I would guess that I've been brought out of anesthesia for about 20 minutes now. The first thing I noticed as I came to is my hearing is improved drastically. I can hear the conversations in the room next to me. I'm still trying to determine if the tinnitus is completely gone or just mostly gone. The ringing is obsolete in my ears. I haven't been able to hear this well for at least 10 years.
All right, so he got his hearing back after 10 years, which is, I wouldn't believe that, but it's pretty amazing. Now, this patient didn't want to be seen, but this is her audio. So she's got the same thing. She's got aflatoxin B, ochratoxin with this brown halo. That's what comes when you test it, the auger in the lab. And then she had less stuff in her sinuses. This is just a little bit of inflammation, but listen to what happened to her.
My symptoms were suicidal depression as well as anxiety. My treatment was numerous SSRIs, tricyclic antidepressants, as well as SNRIs. I also received just under 20 electroconvulsive therapies to my brain to help to treat depression. I also was institutionalized for my condition, and I was considered to be treatment resistant. I recently just had sinus surgery with Dr. Dennis, and it has completely revolutionized my psychiatric condition. I am no longer experiencing any depression, nor am I experiencing the extreme anxiety. I feel as if he has saved my life, and I am no longer on any psychiatric meds. It is a complete miracle. Thank you, Dr. Dennis.
That's why we do this job. The patients like that make it all worthwhile. So this is another example of the same thing. This is the brown halos around the ethmoid sinus mucosa, which is aflatoxin. Now this is really important. All of us who see these patients need to really pay attention to pituitary gland, because over 53% of them have damage to the pituitary, especially growth hormone. So if they have an energy level of 5 with 10 being normal, and or they have an IGF-1 which is below the mean, they have a 53% chance that they cannot produce growth hormone, and they need injectable growth hormone. If you just know those two things about them. So in our study, all of the ones who could not produce growth hormone, all of them had normal IGF-1 levels. So you can't rely on that number. You've got to challenge these people and to produce growth hormone. And if they can't, they need the injectable. So in our study, 51% were growth hormone deficient, all of whom had normal IGF-1, TSH 81% deficient, ACTH 75% were deficient, and then the combination had 41%, and then some of them have prolactin elevation. You know, more of them than you think will have pituitary tumors. So that's why you've got to balance all these hormones. So if you don't do that, they never have any energy. Now the folliculostellate cells have glucans in the cell wall, and so macrophages attack that and destroy the tissue, and that's what causes the decrease in the hormones. So the IGF-1 average was 123, the range was 43 to 285, and the normal range was 88 to 249. So 51% were growth hormone deficient, and IGF-1 below the 50th percentile, most were growth hormone deficient. That's the whole point. So you can also do a Somorlin test on these people. You can inject it or use it as a sublingual drop and see if the IGF-1 goes up. But if it doesn't, you gotta treat them. Now this is a patient who had tremors.
Wesley Baker, 6/25/18, left tremor of the arm and some leg tremor as well.
And then here,
This is after treatment of mycotoxicosis.
so he's markedly improved.
Wesley Baker.
So this is a guy who was in a wheelchair for 2 years, and he did everything known to man to his house in North Carolina, but it didn't work. So he had to go to the beach. This is what happened to him.
Go. This is Tim Green. Fibromyalgia, muscle weakness. Now go backwards and then sit in the chair.
And this is him 6 weeks later.
Hi, I'm Tim Green. I'm now living on the coast of North Carolina, and I'm living right here on the water, where there's no grass, no trees, just the breeze off the ocean, and I'm doing so much better. My health is tremendously better now because I'm living where there's a 0 mold count. That's made all the difference in the world in my health. I had severe headaches. I was in a wheelchair for over 2 years, living in the mountains of North Carolina where it rained all the time and there was mold and trees everywhere. But now living here where there's a 0 mold count, I'm healthy, I'm walking again, and praise God, life is good. Thank you, Dr. Dennis.
Go.
So this is a patient who was in a trailer that was full of mold, and the cat had all her symptoms, and the cat died. So this is what
This is Jennifer Parrish, who had severe mold exposure in a trailer and has trouble walking. She has paralyzed left leg and inability to evacuate her bladder or bowels. And she's had 3 episodes of this after living in a trailer where her cat died and got leg paralysis as well from the mycotoxins. This is Jennifer Parrish on 11408. Patient had right eye paralysis and right eye blindness. Now she can look all the way to her nose, and she couldn't do that before. She had left leg paralysis. Stand up for me. She can walk easily. Go back that way. With her left leg, she can support her weight on the left leg. Lift up your right leg. Lift up your left leg. So she's got all her strength back, and her neurogenic bladder is over, so she can urinate properly, and she had a mass around her spine which has gone away. This is all on Sporanox and vitamin supplementation, and her vision's coming back while they're chelating her for heavy metals.
So this guy can't walk. That's the best he can do. This is about 6 weeks later after we treated him, but he moved to the beach.
Okay.
So he got normal. So then he comes back in a month, and he gets a moldy car at the airport, and he's almost in 30 minutes in the car. He's almost like he was before. This is how fast they can get sick again.
Okay, now tell me what happened to you.
This is a direct reflection of having mold exposure today.
So then, okay, this is new technology. What we're doing is taking the CT scans and running them through artificial intelligence software. And we have the vial on the left is known gliotoxin. So we do about 7,000 different algorithms until you can see something in this. It looks like water when you look at it in real life. It's clear, but you can see this black stuff in here. And we know that this patient over here had a biopsy in her left ethmoid sinus, like you saw that mold plate with the brown stuff around it. Well, she had gliotoxin coming out of this mucosa on the mold plate. So we know there's gliotoxin in there. So with this imaging, we're able to see the gliotoxin in the vial matching up with the gliotoxin in the ethmoid mucosa. So this is a big deal because we can now image mycotoxins in human tissue. So this particular one is trichothecene, and the trichothecene is that the known trichothecene is an MRI scan of a vial of trichothecene. So it shows up black. Shows up black in the thalamus of the brain here. So that you can see why the patient had cognitive issues here. But you can't see anything up here on the regular MRI scan. So this is going to change everything. Now, this is a patient I operate on. This is what the vial looks like on a regular MRI scan. It's just white stuff in the vial. And then he had a colloid cyst in the left ventricle of his brain. He had severe headaches before and after surgery because of this. So then we put it through artificial intelligence. And this is what this gliotoxin looks like in this algorithm. And so the cyst is formed because of gliotoxin in the brain in the colloid cyst. So all this outer membrane formed to protect the brain from this gliotoxin here. So that's why you can't operate on that because it's too far in the brain, but that's why he's sick. And so this patient had these little white spots. These are at the junctions of the gray and white matter where the capillaries are smallest. So these are little infarcts that they get from fungal exposure. And this is another gliotoxin one. So you can see how much more, these are the spots you saw. See how much more is really there that you can't see on the MRI scan. So there's a lot of gliotoxin in this brain. And this is the best one so far. This person had a gliotoxin signature, and this is a gliotoxin in a test tube. And the gliotoxin turns out this is a pituitary tumor that is producing cortisol. So this patient had over cortisol production and had a 100-pound weight gain and high blood pressure. So the neurosurgeon removed this tumor out of the pituitary gland, and then we took the tumor and assayed it for mycotoxins. So we know that this tumor had 11 mycotoxins, not just one. So the learning from this is when you see toxin that corresponds to gliotoxin, it's much more than that. Instead of having one, she has 11. All this black stuff is toxins in the brain. So, and so this is a CT of gliotoxin and this is a CT of trichothecene. Both of them show up black, so you can't tell the difference between them. But when you see stuff in the ethmoid sinuses here, and then in this scan, you know that they've got more than that, maybe 11 of them in there. So it's a large soup of mycotoxins. And this is one that's got a huge pituitary tumor and sinusitis. And so it's got gliotoxin and trichothecene in his urine. So you can see that this is a huge tumor here, and of the pituitary. But see, this is what the pituitary looks like. So up here is the optic chiasm being stretched under stress, and this thing is wrapping around the internal carotid artery here. So, and this is a pituitary tumor with trichothecene in this tumor right here. This is trichothecene. So, and this is trichothecene in the brain. So this is going to be more than trichothecene, probably 11 or more mycotoxins in there. So this is the why patients don't get better. So 90% of the time they're still in fungus. So you got to really retest everything and try to figure out where it's coming from and fix it. You got to get on a candida type diet, and then you got to address the pituitary and address do they have Epstein-Barr or any of these viruses, or do they have Lyme's or any of the other kind of organisms or heavy metals? And most of these people have MTHFR. They can't methylate B12. That's why they can't get rid of mycotoxins. And then rule out cancer. That's way down the line, but some of them have that. So that's a differential. So we got to clean the air, get the mold off the table by the tap test, and find where the highest concentration of the mycotoxins is in the mucosa and in the brain, and treat the pituitary, and then do the air filtration and the laundry additive in the EC fog. EC3 is a product that we use to fog the whole house. And then normal saline nose washes, amphotericin nebulization, and then we use the typical detoxification protocol like glutathione and NAC and liver cleanse, and then we like to use Intramax, which is a liquid vitamin bound to carbon, so the carbon takes the toxins out of the cell. So this is our treatment protocol. Okay, All right, so now it's time for any questions. Yeah,
Let me start, Donald. So first of all, that was fabulous, but I'd love you to expand on a whole lot of stuff. And we have a lot of time to do that in, and we have a lot of questions. Is there anyone else like you in the ENT world? Are there other ENTs in the country who are doing this work or even something like it?
I don't think so. If they are, I'm not aware of it.
I'm afraid I didn't think so either, but many people were wondering. So I'm afraid, I know you're busy. You might get deluged here by some of our requests for your expertise.
Here's the good news. All ENTs can do the sinus procedure. If they're a good technical person with sinus surgery, they can do the surgery. What they don't know how to do is just using a cyclone to irrigate the sinuses with. Now that's available. Stryker makes that product, and all ENTs know Stryker company. And so the key is to get them to irrigate with antifungal, like amphotericin or voriconazole. And I published a paper telling them how to do all this in the ENT literature, but it doesn't mean they're going to read it. So if you've got an ENT guy who is willing to operate on somebody and want to know how to irrigate them, I will be glad to talk to them. They can know in 5 minutes how to do it.
Right, I appreciate that, but like many of the people in the audience, many of us have worked with other ENTs who are even skeptical about the importance of mold toxicity, don't know much or anything about it, and aren't willing to play ball because of their lack of knowledge about this whole area, which is really one of the big issues here.
That's sad. We're publishing an article about the mycotoxin imaging and artificial intelligence, and they won't be able to hide anymore because you can see it. So you're gonna have to do something about it.
We all know that. We just wish it were happening sooner rather than later. So other questions, and I have that as well. How can you get the artificial intelligence imaging with a CT scan? How can you get hold of that?
Well, so right now, what we have to do is we have to have the CD, and we send it to the company. The way this happened is called miraculous, because I would have never thought of this. A friend of mine is the CEO of a company that does artificial intelligence for satellite data, so they can see enemy submarines under the water anywhere they are. So they don't have to send a ship anymore. They just type in the coordinates and they're gone. That's what they do. So when he told me that, I said, okay, I'm going to get all the mycotoxins in vials, and we're going to CT scan them and MRI scan them, and then we're going to see if we can see anything in these vials, running all your algorithms on it. And he said, okay. And that's how it started. And so if we can see this stuff. So right now, that's what I have to do. I get the patients to give me the CD. Then I physically send the CD to the lab they have, and then we go over the CT together. But I usually have specimens too, so we can look at the sinus CT, the brain MRI, and see this mycotoxins. So what's interesting is that one case that we did of the pituitary tumor, that tumor had 11 mycotoxins in it. They were only peeing out 3, and we only could see what we thought was 3. So anytime now we know that we see 1, we're actually probably looking at 11 or 12. It's a soup. It's a big soup of stuff.
Right. So I know that all of the attendees here would be interested in doing this. How specifically, so we can get hold of the CD of the MRI or the CT scan of the sinus, and where would we send that to?
Well, right now you'd have to send it to me, and I could send it to them and go over it together and take pictures. But I got it. What I'll work on is having the demand for this is a really good thing, that we can satisfy that by maybe having you go directly to it. So they have to put the data through the algorithms. It's not in the CT scanner yet. Now that's going to come, but it's going to take a little while for that to happen. But ideally, what we want to do is the people who we've got contacts with the people who make the imaging equipment, and they do the software to view the image. So this will be an app on their imaging software, so that they'll just hit mycotoxins and it'll run through the images and circle where the problems are. That's
Wow.
where it's going.
Wow, that's going to be fabulous
You know,
when we get hold of that.
and then you can say, okay, this person has all these known mycotoxins in their brain or their sinuses. And then what we have to do is say, call this number for environmental consultation, because it's all environmental illness. And so if these guys are knowing it's there, if they don't get involved environmentally, it doesn't matter what we do, it's not going to work, you know, because they're breathing 3,000 gallons of air a day. You know, that's a lot of air.
So lots more questions here. I'm going to ask mine first because I get the right to do that. How would you compare the effectiveness? I mean, not all of us have access to literally washing out the sinus cavity as you do with the cyclone. How would you compare the effectiveness of nasal sprays of amphotericin B or itraconazole or ketoconazole to an atomizer or a nebulizer? How would you compare their effectiveness in your experience?
That's a really good question. The nebulizer, I use what's called a Rhino Sprint. It's a brand name. It's a Rhino Clear Sprint is the name of it. And you just can Google that. The reason I like that is because it takes about a minute aside versus 5 or 10 minutes. So sometimes 15 minutes for a regular nebulizer. And it goes right into the nose. I think the nebulizer gets better than the spray. The spray's better than nothing, but the nebulizer is better than a spray. How much better, I don't know, you know, but we first—
Could you repeat the name of the product you just mentioned?
Call a Rhino Clear Sprint, like Sprint, the phone company.
Got it.
And just Google that, and it's not that expensive.
Right. And do you then have to put the antifungal into that product?
Yeah, you put the antifungal, put 2 or 3 cc's in there, and we let them do a cc on each side twice a day. After they irrigate. Irrigation's first.
Okay, so a lot of our attendees kept asking throughout your presentation. I'm sorry, I should have said it beforehand. They wanted your slides. Dr. Dennis had shared with me that he has so many videos on the slides that really wouldn't have been possible. Now you all will have access to it when you get the video of our whole day's work here later. So sorry, but that wasn't going to be possible today, and I should have told you all beforehand. Let me open the floor to other questions, but one thing I might ask you to do is you kind of shot through your treatment program at the very end. You had 2 slides at the very end of your presentation when you went over what your procedure is and what you did and how you did it. Could you go over that with us more slowly?
Yeah, so you guys probably do more than I do. So what I do, number one, is address the nose first. We irrigate the nose out with normal saline, either with a, like a Navage thing or a squeeze bottle, whatever you want to use. And we put 5 drops of Citra Drops, which is something that's on our website. Citra Drops is 4 citrus seed extracts of different citrus seeds. So it's exponentially more powerful than just GSE. So 5 drops go in 8 ounces of normal saline. We irrigate both nostrils with that twice a day. And after you irrigate, then you nebulize with that Rhino Sprint amphotericin, and the formula is 3 milligrams in sterile water and 30 cc's if there's still sterile water. So it's 3 milligrams per ounce. That's the, and then voriconazole, if they're allergic or something, and they prefer, voriconazole is 12.5 milligrams per ounce.
Okay.
Now, amphotericin has to go in water. It can't go in saline. So, so we put both of them in water and then nebulize either one. I use amphotericin more frequently, but voriconazole works fine. It doesn't matter which one you use.
When would you use an oral antifungal like Sporanox or voriconazole?
That's really a good question. They probably all need it. So I start out getting rid of the yeast first. I give them nystatin and diflucan for a couple of months, and I keep them on oral nystatin after we give them the liquid without the sugar in it first, and then we switch them to the tablet. And they just stay on that long term because it stays in the gut. It only kills yeast. It doesn't do anything to the liver or anything, so they can stay on it forever. It doesn't matter. Then, if they're not getting better, then we add Sporanox or voriconazole. And then there's others, the older ones that you could use, ketoconazole and those. But, you know, I think Sporanox works pretty well on most of them. And I start at 100 milligrams twice a day, so I don't have a liver issue. And some of these people, you know, they have psychiatric issues, and some of them will double, triple, and quadruple their dose because more is better. And then I've had 2 or 3 people do that, thinking they're helping themselves, and then they're just totally. One of them had to go ICU because they knocked their liver out, you know, after doing that.
Do you ever use oral compounded amphotericin B?
Oh yeah,
Okay.
that's wonderful. It's 250 milligrams, and that's great for yeast. The only problem, you know, there's no real problem with it. I like it because it doesn't get absorbed, and it's really safe.
Mhm.
And you have to talk to them about that because they'll tell their other doctors they're taking 250 milligrams oral amphotericin, said the guy's trying to kill you, don't do that. And you know, you really have to explain that to them because they're going to get a negative on that.
Yeah, right. And we do as well. I mean, some of the things you're talking about now are fairly standard for us. What I'm excited about is some of the newer things. How often do you think people have colonized their GI tract and have sinus issues?
All of them.
Great. We're in complete agreement. Thank you.
I mean, I haven't seen one who didn't have that, you know.
Okay.
See, I'm at an advantage. I'll look at the vertical part of the tongue when I scope them. I go in and look at the vocal cords. Well, I haven't seen anybody who wasn't totally caked up with yeast. Now, their horizontal tongue might look fine. Most of the time they don't, but well, I photographed that and handed them the photograph, so that gets them busy doing the treatment.
Great. You have access to tools that not all of us do, and that's great.
Okay, top test. That's a good question. Okay, you take a mold plate, which is an SDA auger. We use that one because it seems to grow it out better than just about anything else. It grows out all fungi very well. It's high in sugar. And so as a side to that, if you take a mold plate that's got yeast all over it, and then you put diflucan on top of it, it won't kill it because it's got a sugar source. So that's the point of the diet. You know, you've got to get them on the diet, and these antifungals are totally worthless. And they'll say they're resistant to the fungus, but they're eating sugar. It's not resistant. They're eating sugar. So Candida has a sugar receptor on the cell wall that makes it change into the invasive hyphal form from the yeast form. So the invasive hyphal form, the hyphae are 3 feet long. They circle around and go through tissue, and they make it antifungal resistant. So that's why the diet's so important. So you just take a mold plate, you open the plate, turn it upside down so that the media side's on what you're tapping, and tap it 3 or 4 times firmly on what you're testing, and then recap it. That's all it is. Take a couple of seconds to do that. So we do the patient's front of their clothes, back of their clothes, and their legs every time they come in the clinic, just like you're doing a blood pressure or a temp on them or a weight. It's just part of everything we do. And so when they come back and say, well, I got my house fixed, it's cleaned up, and their mold place got 40 on it. So you're not through yet. You got some more work to do. And it's either the car, the washing machines are a big deal. All the front loaders are full of fungus. So the one we recommend is the top loader, the old school. It's a Speed Queen TC5. Just write that down. Speed Queen TC5. That's the one that doesn't have a mold problem. All the new top loaders, especially without a spindle, have mold problems. It has to have a spindle and no water saving. Otherwise, they're sleeping in it and they're wearing it, and then their house is clean.
Okay, you had, so first of all, most of us have been doing something similar on the TAP test. We've talked about it in terms of checking pets for mold as well, like having the pet stand over the plate and rubbing them.
That's too numerous to count fungus. That's normal for them.
So you don't think that that's relevant?
Oh yeah. If they're sleeping with the pet, they're not going to ever get better.
Thank you. A couple of other products that you mentioned, and I'm thinking of it. You mentioned EC3 fogging and EC3 laundering. What exactly is that product that you mentioned?
Okay, the EC3 is something that we made. That's you can get that on sinus5.com. That's on a website called Microbalance, but Sinus5 is easy to remember. The number 5, sinus5.com. So on that website, we have a bunch of products that over 20 years ago, there wasn't anything out there that was any good. So we just made some stuff that worked. And what it does, it's got 4 citrus seed extracts in it. And it's a really good for you. You use the detergent that you always use, but you just add that into it. And it just kills everything.
And what about using it for fogging?
And so the laundry additive is a little different. The foggers doesn't really have an odor. It's 4 citrus seed extracts. And the foggers on our webpage, it'll go 30 feet, so it's very powerful, but you want to mist everything. So you can mist the house. We mist our patients, especially the ones that are full of fungus and I can't be in a room with them. I'll show you this a little later, but I fog the patient front and back. Have them turn around. I fog myself. We gown them. We put a hat on. This is ones that are making me sick. I can smell them. And then I put on 100% oxygen to see them. Otherwise, I can't even see them. The ones that are really bad. Scott, I can't be exposed anymore because I've got so much exposure over the years. I'm hypersensitive now.
Understood. Okay, so let's continue on. Is it possible to get your MRI?
Well, yeah, most of my patients don't come from Georgia. They come from all over.
I expect so. I expect you're going to be getting a whole lot of referrals from this group.
What we do is we have a questionnaire intake, so they got to jump through the hoops and be compliant before I see them. That I know they're going to be, environmentally compliant is what I mean. Mm-hmm. And so, and not in denial. Oh, we already fixed the house, we're good. And then they're peeing out all these mycotoxins, And so, no, you're not good yet. So if they'll do what we ask them to do, yes, I see them. But if they are argumentative, we don't see them.
I suspect that the referrals you get from us will be people who are already getting their air clean, already understood that, already remediating their home, but they're not making any progress and would want your help in figuring out if there's a sinus component. I think you'll see that those will be the referrals you get from us.
That's ideal because I can fix those fast. That's
what we're looking for.
The ones that need surgery, we can move ahead if they've got everything. So when they come in and we tap test them and they're like a 4 and not a 25, as long as they're going to work at it, I'm good with that. But I can identify, okay, you still have a mold problem, even though you've done a lot of really good stuff. So the thing I want all of you to take away from this is get that ionizer, you know, the ionizers that's on the page. It looks like the little fan. The phone number is on there. So this is the very important. This thing is called the Ultimatum 1100. That's the most important thing I've found in the last 20 years. It's the phone number is 800-247-1020. If they call the phone number, it's actually less expensive than ordering online because it costs them a lot to do that. So this is the thing that puts the ions in the air. In 2 minutes, fills a 20 by 40 by 8 foot room with positive and negative ions. So the air that they're breathing is okay. So this is a big deal and a big breakthrough for me because I've had patients that I operate on. They came from Texas and they bought a camper and it was full of mold. So the post-op visit, it was just awful. Polyps were everywhere. It was infected. They had fiberglass ulcers everywhere. Then they got this thing. I saw them a week later and almost all of that stuff was gone endoscopically. So I know this thing works. So this will help you people who can't seem to get it right. At least you know what they're breathing is okay.
Okay, absolutely. And one of our attendees, Deborah, just put down in the chat some of your published papers, the references, so people can access that more easily. Just a comment for you. Okay, let's, in addition to a,
Now, let me
go
say
ahead.
about now surgery. You saw several of those people. Their CAT scans would have been read as normal. That's an insurance problem. So the symptoms they have is really important. So they have severe headaches and sinus symptoms, and a negative CAT scan. You have to prove that they failed medical treatment, which is easy, you know. But you have to jump through these hoops for insurance to pay for the surgery. And then sometimes they still won't pay. That's kind of rare, but it does happen. And then we have to do them anyway, but then it costs more. So if we can get the insurance company to pay by jumping through the hoops, it's better for the patient.
Fabulous. So I have an excellent question here from Scott Forsgren.
Do you think systemic small lipomas could be a protective response to mycotoxins? Yeah, I bet those things, if you take one of those things out and just send it to Dennis Hooper, I bet it's full of mycotoxins. That's what we did with the pituitary tumor. He's a pathologist, so he can really test any kind of tissue you can give him.
Right. Most of us have worked with Dennis for a long time, so
Yeah.
I think that'll be easy.
Yeah.
Okay, next question.
How long yeah, I do 2 hours a day and it's 8 to 10 liters a minute of oxygen. I think that's really important. We only do oxygen concentrate, but don't get one that goes 4 liters a minute. You need a 10 liter a minute machine to be effective. And don't get a used one because you know what that's been in, you know?
Yeah, got it. Good answer.
Not experience a lot of sinus spike. Yeah, okay, you got really 3 different genes. 80% of the population does not have chronic sinusitis, but they have, they can't excrete the toxins fast enough. So I think that's the MTHFR gene, but I'm not sure about that. It's some gene that doesn't allow them to excrete it as fast as normal people. So they can have perfect sinuses, not have sinusitis, but you know it came in through the nose. So the parasinus nasal mucosa, you can see inflammation in there on CT scan, but not sinusitis, you know. And so those people still need surgery if maximum medical therapy and environmental therapy is not effective. So we do all that stuff, and you guys know how to do all that. If they're doing that and they're not getting better, and their air's okay, then they need surgery.
Just a quick comment on the MTHFR gene. One of the least important mechanisms for detoxification of mold on a deep dive study we did a couple of years ago is methylation. So although methylation is an important mechanism of detoxification, not specifically for mold toxin, other detoxificational pathways are way more important. So I just am not sure that the MTHFR is going to be where we want to be looking.
Okay.
Okay, just a comment.
But the
Jill,
Can I hop in though?
absolutely. You want to get in on the
I
fun?
think the
Yeah.
oxygen helps.
Okay.
I have actually seen correlation with the MTHFR, and I don't know if it has to do with clearing the byproducts, so the inflammatory byproducts, but also a correlation to SNPs and glucuronidation and sulfation. So
Okay.
yeah,
Good.
I think there's
good.
a fun, that'll be our next study, right? All the genes.
We got it. Thank you. Do you want to pop in and ask your own questions?
No, this is great. I'm loving everyone's questions. It's all my same. Yeah.
Okay.
And
fabulous.
I'll just put a plug in there for Dr. Dennis's surgery. He's helped numerous patients. They've found fungal balls. These are patients who didn't have sinusitis. Everything was cleared by CT, just things that were chronic neuro, migraine headaches, and probably only one patient did I send that had sinusitis or sinus symptoms that weren't getting better with the sprays and nebulizers, and it's revolutionized her health. So yeah, just put a plug in. Thank you, Dr. Dennis.
Well, you're getting all that stuff out of the sinuses, and we have people in the recovery room that, like the guy that's hearing back. Well, they feel like a shroud has been opened, and they have more mental clarity. Some of them in recovery, and some of them takes a few weeks later. It's all different, but it gives some dramatic improvement just by removing that toxic load from their brain, basically, and their pituitary gland. So all you guys get the pituitary off the table. I mean, most of them are going to need some help. They're going to need thyroid cortisol, and some of them are going to need growth hormone. And you can still give them Simorelin, sublingual drops. Simorelin, they can make that in the lab, and that's not expensive. So that's growth hormone releasing factor. So then if their IGF-1 doesn't go up on that, they can't make it. So then they got to get injectable. So they got to get tested by an endocrinologist. That's going to be a whole nother workshop to get the endocrinologist to test them, because he thinks the IGF-1's normal. But we wrote a paper, so you can give them the paper and show, no, it's not going to be normal. You got to test them anyway. Do all people with sinus college that have symptoms of sinusitis? No. Okay, so the sinus, the gene that makes these people get sinusitis is an eosinophil infiltration into the mucosa, which the eosinophil bursts and releases major basic protein, which makes a pit in the lining. That's what causes chronic sinusitis, but 80% of people don't do that. So they'll have colonization of fungus or yeast, and all of them will have staph in their nose. So staph is nothing new for the nose. It's just like E. coli in the rectum is part of it, and it's not abnormal. And most of them have been on multiple antibiotics, so they have Marcons, and so that doesn't mean they need all these antibiotics. You can treat the nose, but don't treat the nose with antibiotics unless you're using antifungals. You got to use both of them if they've got pus. Now, if they have no pus, I don't worry about endoscopically they're normal. I don't treat that, because everybody's got staph in their nose. That's part of the normal flora. And most of them, it's going to be Marcons because they've had multiple antibiotics, but it's still a part of the normal flora if there's no purulence. If there's purulence, then you got to get after it. But most of the time, you can do it with sprays. But remember, you've got to use amphotericin with whatever you're using, or it's not going to work long term. It'll work for 5 minutes,
Okay.
A calcium salt secreted by fungi. I don't know the answer to that. I know there are calcium salts. That's why you can see the little white dots, but I don't know if it's an oxalate or not.
Okay, well, in that context, I'm sure you know that Aspergillus and some other mold species make oxalates. So that would be likely.
Likely, yeah.
Okay. Okay, I think we,
So the MRI you order is the same as any MRI. You're taking the same data, but you're taking that data and you're running it through artificial intelligence software. So it's the same exact scan you always use. As long as you have a CD, I can, do that. But think about it this way. If they've got it in their urine, where is it? It's everywhere, right? It's in their brain, it's in their sinuses, everywhere. So it's not unusual that you're going to find it on an MRI scan. The only reason I think it's important is it might, where the urine doesn't often cause people to get into action, seeing it in their brain does. They get it. We already know it's in their brain because it's in their urine. We already know that, but if they see it, maybe they'll get busy.
okay, next question. Jill?
Quick add-on, is contrast required in those MRIs?
They're going to want the contrast for imaging the pituitary, but I've got a patient right now that when that huge tumor you saw, he's allergic to the dyes. His is so big, you don't need the dyes. But they'll want to do that. If they have a dye issue, just tell them they can't have it and you'll get enough data from that. Okay, that's a good question. All right, so nasal and sinus polyps are formed because of an immune reaction to fungus, period. 93% of the time, that's right. 7% is not right, but I'll go with the 93. So if you're getting polyps back, you are in a moldy environment 100%. And you got to find the cause of it and be diligent about it in order for the surgery to work. Yes, you need surgery again after you get the environment fixed. But sometimes the polyps are so bad that you could be in danger of getting meningitis or a brain abscess. So you got to remove it even before you're in a safe place. So that would go back to the nebulizing with amphotericin and washing out and get that ionizer, that ultimatum 1100, do all that stuff while she's trying to figure out where it is. But that'll help lower the load. And sometimes you can get polyp relief just from that ionizer because what they're breathing, unless it's their bed, if you got to change the mattress and all the stuff, put it in EC3 laundry so the pillow and where they're sleeping is okay. The dog and the cat can't be in the bed, or I can't help them. Just because they're too numerous to count fungus, all of them.
Okay. And just to be clear, the ionizer, is that the ultimatum 1100?
That's the ultimatum 1100.
Yes. Okay, good.
I'm going to say the phone number again. 800-247-1020.
Okay. Okay.
All you got to do is dial it up. They'll give it to you.
Okay. All right.
Would you be helpful to source it? Oh, yeah. The filter is the filter name. I found this is a really good HEPA filter, and it's cheap, unlike most of them. It's called a Medify, MEDIFY, AIR, AIR, capital AIR. And the one that's sort of the mid-range is MA40. They have all sizes for all different rooms. They'll do about a 800 square foot room. They have a 120 and a 60 and all that. You can figure out which one you need, but that's under $300, which I've never seen something like that under. And it's also got an ionizer in it. So you have offensive and defensive. The HEPA air filter is less expensive, but it's defensive. And so it doesn't broadcast it throughout the room. So, but the ionizer does, so that you can ensure that what they're breathing is good. Well, with a HEPA filter, you can't exactly do that, but both of them are good. Unfortunately, the ultimatum is more expensive. It's like, I think it costs too much myself. It's like $1,500 or more.
Wow.
So it's way expensive, but if you fill up a 40 by 20 by 8 in 2 minutes, that's pretty much worth something, you know.
It's cheaper than remediation for people who can't afford it.
That's right. And it's a way that you can start getting improvement before you can either find another place or get out of it. It's very worthwhile. And I usually don't say that, but I'm sold on this just because endoscopic exams and post-op things. What is this? Oh, BMWs. I'm not against BMWs, but they have one of the models. It's not all the models, but one of the models. The coil box does not have a vent for the water to get out. So in the summer, when you drive a car up your driveway, there'll be a water stream where the water's coming out of the coil box. Well, this one doesn't have water coming out of the coil box. So it stays in there and it gets full of mold. A brand new one will be full of mold in a month. I know that because my daughter had one. so then you've got to keep putting the stuff in there, the EC3 spraying all the time, and that lasts about 3 or 4 days, and then it's back again. So you don't want to get a car who doesn't have a drain for the coil box. So the water freely flows out of there from the coil box. How long do you wait for the first visit tap test? Oh, the tap test, we sent it to the lab because I don't want any discussion about it, you know. So the lab takes 2 weeks to get back. We just go ahead and automatically send them there. So then the patient has a lab report they can look at. It tells them what the numbers are and what the organisms are, and it gets them more active than if I just say, look at all these mold on this plate. So we use immunolytics for that.
Right. I've been a big fan, as this group knows, for years, of using the immunolytic lab to help us get some of that data.
Yeah, and the patients can do their own mold plate test themselves. How long do you? I thought fogging doesn't work. Oh, fogging works. Fogging is really a good tool. It's not the answer, but it'll knock the counts down on the surfaces of things. You're trying to miss everything, so you can miss your whole house in about 10 minutes. And you don't put it down and leave. You never take it out of your hands.
What do you mean by it's not the answer?
It massively reduces the counts on the stuff. But of course, unless you fix the reason why it's there, in a few days it's back again. You know, so you want to use all these tools as a help to get better quicker, but not to ignore the reason why it's there. You've got to fix that. Why is the humidity up? Where's it coming from? And be very aggressive at it. Okay, you want to do amphotericin is 3 milligrams per 30 cc's of sterile water. And you want to put 2 cc's of that in a nebulizer. And then once you do that, you want to run some distilled water through the nebulizer for about a minute or so, or else it stops working. How do these? I just see my mistake. Well, send them to an ENT doctor to make sure they don't have a fungus ball. They can see those on CT scans of the sinus. But yes, all of these patients, like all underlined 5 times, need lavage with saline. I use Citra drops. You could also use SSKI, supersaturated potassium iodine. But you use that only if you have purulence, because you don't want to overdo that. And the dosage is 5 drops per 8 ounces of saline on both of them. You can't hurt yourself with Citra drops. It kills virus, fungus, and bacteria. So you lavage and then you nebulize with amphotericin or voriconazole. You do both of those. Lavage alone is not enough. And they got to do that twice a day, not once a month. Okay, how you know? I don't know anybody in Seattle that does that, but if you find an ENT guy who knows fungus causes chronic sinusitis, I will be glad to talk to him if he calls me. And there, I can send you the papers. I sent you 2 of those papers when I was signing up for this that I wrote, and all the details of how to do that are on that ENT paper.
Okay. Okay, let me try to fish out that email and I will get it out to everybody, but it won't be today.
That's fine, and I'll be glad to talk to any ENT who wants to call me, but I'm not going to call an ENT and talk to him. That's not going to ever work.
We've all had the same experience. Yeah.
On the IgG, I like that test because when a lot of these people have been allergists and they had IgE mold testing, and most of those don't have positive IgE antibodies to mold, but the IgG is a delayed reaction, and most of them have positive IgG antibodies to mold. And it's a good test to see. The patient, sometimes they get more active when they see they got high levels of mold antibodies in their system. It's helpful that way, and it's helpful sort of to know how bad their burden is by the counts, and then which organisms they are. So you don't have to do it on everybody, but I think it's a good tool to just show people. They show their culture. It's in your blood. It's in your urine. You know, it's just additive information.
Do you find any particular species more often on doing that test?
No, I haven't noticed that. It's kind of all over the board. You know, aspergillus and penicillium are very common, but also fusarium is common, and candida. Almost all of them have positive candida IgGs.
Okay, good. Next slide.
Marcon's testing. That's, you know, we just talked about that. Okay, the Marcon's Jubilee, spraying them for the rest of their life is not the answer. Okay, because all this stuff they do, none of it, 0 of these things work long term. 0. Okay, the way you get long term results is you have to kill the fungus in the air and in the nose. If you don't get the air first, you're never going to get in the nose. So if you get that, then if you use the VEG spray, it'll be effective. But without amphotericin or an antifungal, it won't work because you haven't removed the fungus, which is causing the pit, which causes the place where the staph hangs out. If you get rid of the pits, you don't have the staph that you can't get rid of anymore.
I love it when experts agree with me. Thank you. Keep going.
Can we interject real quick on a question also of the use of steroids, a small amount of steroid in the nebulizer?
Yeah, I like to do that. I use a tiny amount, like give it to a 2-year-old. I use Decadron, but you could use any of them really. But I put like a 0.5 milligram or less in an ounce of saline with or an ounce of water with amphotericin, and you can go down from there. Now, some people, if they got contraindications, that you got high pressure in their eyes or any of that stuff, I don't use steroids on them. But the reason I use it, well, it helps decrease inflammation, but more importantly, it stops them from getting sensitive to the drug. And so that's why I like it. And I rarely have somebody have a problem with it. It's maybe 2%.
Right. Next slide, please.
Citrus extracts.
But its use in patients with mast cell activation.
Okay, so that's another one. That's like Marcon's. Okay, so mast cell activation is sort of like calling appendicitis, you have pain. That's your diagnosis. You know, so what is the mast cell reaction to? What is the antigen is the question. So it can be multiple antigens, but if it's fungus, when you get the fungus out of the way, you remove the mast cell activation syndrome. So, but the treatment, why citrus extract? Well, if they're allergic to citrus, you can't use that. Some of them are, some of them aren't. But if they have a citrus allergy, you can't use citrus drops in their saline. You just use something else. You know, use iodine, which will be fine. But you only need, more is not better. About 5 drops is all you need of iodine. So how can our patients actually, the AI scan information, you can't actually access that except through me right now. We haven't gone public with it. We're still trying to get a couple of hundred of them and then write a paper. And we've got another one who's going to have pituitary surgery, one of like 3 of those, and then write a paper and then try to and publish that and then try to get it into the software of these companies. It's going to be probably take a few years to do it, I guess. Okay, yeah, we can do that.
Okay, let's do that at the end of these questions.
Okay, do you
Dr.
find
Dennis?
some cases of chronic asthma? Yeah, some of them got yeast related. I'll just say this: if you get fungus out of the body and out of the air, most of your asthma problems will be massively better. Because I've had many patients who had asthma and had chronic sinusitis and infection all the time and bronchitis and a massive number of allergies when they were allergy testing. When you get rid of fungus, fungus is the master antigen. It revs up the whole inflammatory cascade and makes them get allergic to a lot of other things. So if you get rid of fungus, you're going to knock down your other allergies a good bit. If you wait and watch how that works. Get rid of it in the air and in the patient, and that you know you've got fungus out of the way, and watch what happens to the other allergies 2 or 3 months later. They drop way down, and a lot of patients get off allergy shots after that. And they had multiple allergies: grasses, trees, weeds, all that stuff, dust. So it's a major contributor to all of the other allergies people get. It's the master antigen, I think. Amphotericin versus I use amphotericin most of the time, unless they're allergic to it or have a sensitivity, then I use voriconazole. Some of them, if you switch around a little bit, some of them have a better result with one than the other. Then I'll use, like clinically before you have surgery, some of them may have they do better on one than the other, and I'll just use that one for the surgery. Yeah, I use intranasal sprays of voriconazole and amphotericin. EDTA is okay, but remember, the biofilm is because of the fungus. If you want to use EDTA, that's a temporary solution. The permanent solution is getting rid of the fungus in the air and in the nose. If you don't do the air first, you're not going to ever get rid of anything. You're not going to have enough drugs for them. So nothing's going to work. Well, testing and treatment for mold allergy. That's a really good question. Okay, so when these people are in the severe environments like they are, I don't start them on allergy shots because you're just going to rev them up more. I try to get their environment straightened out and then start allergy shots on them. And then usually you retest them, and most of the time you get less allergies. And so I'm for allergy shots, but not in the middle of a severe environment where they're really messed up, because you're just going to make them worse. And they're going to have you have to start with a -12 or something like that. And even that sometimes revs them up. You got to remove the master antigen first and then go to allergy shots, in my opinion, with these sick people from mold. When you add that to them, a lot of them just crash. Yeah, the ionizer can be, yeah, it's called a bipolar ionizer. You can put it in the central system. Yes, it has value. Now, it doesn't work as well as the one in the room because it goes through all the ducts. And the ducts remove maybe 30–40% of the ions that stick to the ducts. So, but it's better than nothing. But the purpose is it's in the coil box, and so the coil virtually never gets dirty. If you have an ionizer in there. It's Medify, Medify, Medify Air. That's right. That's right, Medify Air. Voriconazole goes in the brain better than Sporanox. So with the brain, I would use voriconazole in the nose and orally, but the main thing you want to do is your oxygen, glutathione, NAC, liver cleanse, Intramax, and a binder. You will, if you got the air clean, you can get the stuff out of the brain with that protocol. It starts moving out of the brain. It's pretty amazing. Now, if they got a tumor, you got to take the tumor out. If you got a pituitary tumor, that's got to come out. You know, unless the endocrinologist is going to do it medically. I would like newer construction home. The high mountains or the desert or the beach. I like the beach better than all of them. I would say you got to get a home that's over a year old because all the chemicals will really nail them if it's brand new with no carpet. And they can put that ionizer in a new construction and just let it go. It'll remove the VOCs, but you still don't want to get a brand new house. You want to get one about a year old, between 1 and maybe 8 years old. And then you want to mold plate test it and see what the counts are. But number one thing you want to get the patients to do is what's their first impression when they enter the environment? Is the air clean and fresh, or they don't know? If they don't know, it's no. Or if it's thick, you know, chemical air, it's no. So you can canvass a bunch of houses quickly if you just do that. If they don't know, it's no. Usually, if it's really good air, they know. Most of them do. Now, some of them can't tell if they're in sewage. I mean, they don't know. And they have a big disadvantage if they don't have a partner who can tell. Then they got to rely on mold plate testing, which takes longer. Would ionization treatment help their environmental toxins? Yeah. The ionization with that 1100 machine, the Ultimatum 1100, that'll get rid of all that stuff, the odors and the toxins. Anything you smell will be gone. Now, in terms of smoke, I don't know about smoke. It depends. I know it'll get rid of it in the air, but it'll continue to off-gas. So I had a experience with a Christmas tree. We got a fake tree for occasion, and then I pulled it out of the box, and it was so much odor in there. It smelled like cardboard and all these chemicals. So I had to wear oxygen just to deal with it. So I put 2 of those machines in it, and 24 hours later, I could stick the tree in my nose and I couldn't smell anything. So that was a severe issue. But pesticides, I'm not sure about. If it's a volatile organic compound, it'll get rid of it. I don't know more about it than that. The organism part of it. Yeah, you go vacuum and swift them out of there. They're dead, but yeah, you got to clean them out. They're not going to hurt you, but It's like dusting, you just get rid of it. Yeah, it's 3 mycotoxins, sure enough. Okay, the other reasons that you can have for mycotoxins, if they eat frozen fruit or a lot of grains, that it can be coming from their food. So you get them off of grains and no frozen fruit. And that usually gets rid of it as a food source. Usually, I'm not surprised, Ermi being negative, that can mean a lot of things. That can mean it's awful or it's okay. That can mean either one of those things being negative. So just so you know, all the testing out there for fungus, the numbers they consider to be normal, okay numbers are not normal for these patients. These patients get sick at those levels and they require much lower levels. Like a Hermine, it needs to be like under 2. And some of these other tests, they need to be much lower than what the tester considers normal range. So none of those people that do those tests have any medical input to that conclusion. They literally made up a number by taking a bunch of averages, which is worthless for us. So I don't rely on any of those tests. The best test is for the patient to do their own mold plates, because that really doesn't lie. Because you can have a written report saying that this is fine and it's not fine, and then they think it's fine. So they don't get active to do anything.
Okay. Last question before we take a break.
Front loader washer is the Speed Queen TC5. Speed Queen TC5, that's the best one right now. It's old school, it doesn't use a water saver, and it actually agitates the clothes and gets them clean.
Okay.
It's a top loader.
Okay.
If you got a front loader, you got to get rid of it. All of them are full of fungus eventually.